All right, I'm super pissed off because this research, this kind of evidence in the medical world is really just evidence of deceptive practices and, I don't know, dishonesty, fraud. I'm not sure what you want to call this. I hope you will stick with me through the end of this so you understand exactly what's going on, because it's, if you're not angry by the end of this, you should be. So this paper, I'm going to link to it down below and I'll try to put it on screen. It's the patient acceptable symptomatic state for the modified Harris hip score and hip outcome score among patients undergoing surgical treatment for femoroacetabular impingement, FAI, or hip impingement. So this is a 2015 paper, and what they were doing was trying to figure out a correlation between patient satisfaction and objective scores. So by objective scores, we're talking about patient-reported outcome measures, which sometimes you'll see abbreviated as PROMs, and that's a fancy word for saying a patient scoring on a questionnaire. Okay, so the modified Harris hip score is the name of one questionnaire that orthopedic surgeons like to use in their research studies. The hip outcome score is another questionnaire. There's another question called the PASS, the patient acceptable symptomatic state, right, in the title of the paper. And that's a yes-no question. So PASS is basically saying, hey, now that you had the surgery, looking at all your symptoms, do you think your symptom state now is acceptable? Basically, are you satisfied with the surgery? Super simple, super straightforward. It's really obvious what it means. And then there's the modified Harris hip score, which is a series of questions. I forgot how many questions, but basically they ask you things like, how does it feel to walk one block? Is it easy, hard, difficult, whatever? How much pain do you have on a regular basis? What does it feel like to get up and down from a bus? What does it feel like to get up and down from a chair? And they have different scores related to your answers on every question, and then they give you a total score, and then calculate it out to say, okay, you have this number of points out of 100, okay? The hip outcome score is similar. They ask you a bunch of different questions. You answer based on a scoring system. They total it up, and they say, okay, out of 100, woohoo, you improved, you didn't improve. Now, what they wanted to do in this study is figure out, let's say, modified Harris hip score. What score correlates to your saying you're satisfied, okay? So like if you achieve PASS and say, yeah, my symptom state is good, what's your score on the modified Harris hip score? What's your score on the hip outcome score? 50, 60, 70? Like what are the scores that relate to your passing, okay? Not to your death, but to pass, right? Achieving pass. All right, so they had 130 patients and they did the surgery, and in 1 year after surgery, they wanted to see what the numbers were on the Harris hip score and the hip outcome score that related to your achieving pass. Okay, makes sense now? So at 1 year after surgery, they said the cutoff values, they believe, based on this fancy statistical trick they did, statistical analysis they did, was 74 on the modified Harris hip score and 87 on the HOS, the hip outcome score for activities of daily living, and 75 on the hip outcome score on the sports subscale. So that's when they ask you questions specific to sport, right? So I said, basically, if you achieve a 74 on the modified Harris hip score, you probably achieved PASS. Now, why are they even doing this? Like, why are they trying to convert these numbers into PASS? And the reason is, in many orthopedic studies on hip surgery for FAI, they just use the questionnaires and they don't ask about satisfaction. They just say, well, answer these questionnaires so we can score you. And if you achieve a certain number of points of improvement, then we consider it a success. They don't ask the patient whether they're satisfied. Just ask them to answer the questions so they can score it. And if they hit a certain number of points, it counts as success, okay? So then in this study, what they're trying to do is say, well, if we look at all these other studies, we can look at the scores that those studies published and determine how many patients were satisfied. Does that make sense? So you can see like, oh, now we can translate all those scores into satisfaction scores, right? So that would be kind of cool. That'd be nice to know. It's a good idea. Now, when you're doing this kind of analysis, think about the setup. You have 130 patients, and you need to find the patients that are satisfied, that achieve pass. Okay, so from that, you're going to look at their scores to determine what scores relate to pass, right? Like, what are the cutoff numbers based on the number of people who actually achieve pass? Here's the funny thing. They come up with these numbers, right? And they have all these data tables. They show you all these scores for the hip outcome score. They show you the Harris hip score, whatever, blah, 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 all the sub-scores. They show you different percentiles of different things. All this stuff is in the data tables. They discuss it throughout the paper. You know what they don't tell you? Out of 130 patients, how many do you think achieved pass? How many of them were satisfied? Because that's important information if you're trying to determine whether their math is good, whether their statistical analysis is good. How many do you think out of 130 achieved pass? They don't tell you. It's not in the paper. So there could have been 5. There could have been 10. It could have been 15. The thing is, they have every incentive to tell you how many patients achieve pass if the number is high, and if the number is low, they have every incentive to hide it. Because if the number is too low, the cutoff values that they come up with are nonsensical and invalid. And if the numbers are really high, it means that the surgery is on its face, obviously, clearly already a satisfactory, good and effective surgery. But they can't even tell you that. They won't tell you that. Now, why would they not tell you how many patients achieve pass? Again, the incentives are all there. If this is a highly effective surgery, you should find out from this paper, when they ask patients, are you in an acceptable symptom state, you should find out that a high percentage are satisfied. Instead, they conceal that number. It's not anywhere listed in here because well, I can only speculate that they don't want you to know how many actually achieve pass because the number is low and would call into question the entire conclusion of this study. Because they know it. The authors know the actual number, but they didn't tell you. They just gave you their end result and won't let you check their math. So what does that tell you? Well, it could tell you that maybe the number was really high and they were just too embarrassed to share their amazing results, or maybe they were too embarrassed to share that there was a very low number of satisfied patients out of their 130. I think that is the most reasonable supposition because a 2013 paper actually showed that fewer than half of patients had their expectations met with regards to hip pain. So I'll link to this one. It's fulfillment of patient-rated expectations predicts the outcome of surgery for FAI. And they showed 56% of their patients did not have their expectations met for hip pain relief. 61% disappointed for return to sport and sport function, and 53% were disappointed in terms of general function. And then a 2021 paper, a Danish study, reported they actually asked patients, are you satisfied? They actually asked the pass question, like, based on everything, how do you feel? And they said that only 46.7% were satisfied. So it's highly likely that this totally bogus paper that talks about these cutoff values had very low pass scores, and they just wanted to hide it. And that's called intellectual dishonesty or cowardice. So all the authors in this study who put this out and concealed the patient acceptable symptom state numbers, I'm not sure what you were thinking. I do know, I have some speculation on it. If you're watching this video and you have some speculations, you think you might know why they would conceal that number, or maybe you're a really good researcher and you find the actual pass numbers in here. I can't find them anywhere in here. I've read through this thing 7 times. I've looked at the tables. I cannot find the pass scores. If you can find it, drop me a comment down below. And if you want to speculate about why they hid those satisfaction numbers, I'd like to hear it. Drop me a comment down below. And if you were thinking about surgery for hip impingement and you had never seen this study and you didn't realize what was going on and you haven't seen my other videos, make sure you check the links in the description box to some of the research links that talk about the success rates, because the success rates on this surgery for FAI are just not that good. So I wanted to get that off my chest. I hope you dig into the research yourself and look into it. If you're somebody who's been considering surgery for hip impingement, I urge you to consider the research and see the actual satisfaction rates, because they are below 50% on a consistent basis in multiple studies. Links are in the description box. I hope that helps you out and gives you some sense of what you're being sold. I would encourage you to look at other channels, my channel, every resource you can on different exercises to help yourself. I don't have all the answers. I have a lot of different exercises. I have a lot of experience with different people with different hip pain problems, but I am not going to have every single answer out there. So please go out there, discover, look for stuff that's going to help you. Don't just rely on supposedly scientific stuff that comes out of physical therapy clinics or out of orthopedic clinics, because a lot of this stuff is really bad. I'll have a link to the worst exercises and a whole explanation of how bad some of the cookie cutter PT stuff is in the description box down below. Please don't just fall into the trap. Make sure you look around, eyes wide open. I have a program on my website. It's money back guaranteed. You can check it out. If it feels like a good fit for you, go for it. If you buy it and it doesn't feel like a good fit for you, you can always get your money back. My team will always give you a refund. You've got 60 days to see if it fits you or doesn't fit you. If it doesn't work for you, please take the money back and find something that does, right? I don't want to keep anybody's money if it doesn't help them. If you don't want to give me your money in the first place, that's fine. Find another coach, find a physical therapist, find somebody who seems to make sense to you and get help from them. I hope this helps you out. Please click the like button if you want to support me and also the Wounded Warriors Project. From now to the end of 2024, I'm donating 1 cent to the Wounded Warriors Project for every like this channel gets. And for every new subscriber, I'm also going to donate 1 cent to the Wounded Warriors Project. So for every like, 1 cent. For every new subscriber, 1 cent to the Wounded Warriors Project. I really appreciate you supporting me and them. I want to donate at least $5,000 this year. So please support me, hit that like button, watch my free videos here. They'll probably help you out. And as always, I hope you remember that pain sucks, life shouldn't.